Now, it affects more than half of women at least once in their lifetime. A urinary tract infection, or a UTI, affects the bladder, kidneys, or the tubes connected to them. It can be extremely painful and causes a sudden need to urinate or a burning sensation when doing so. UTIs are normally treated with antibiotics, but for some, that doesn't work, and they're left in debilitating pain for years. India Grant reports.
This is the medication Leanne uses to treat her chronic urinary tract infection, or UTI. Usually, such infections are easily treated with a short course of antibiotics, but for Leanne and others like her pain has not gone away.
It can completely alter your life. Some days I'm housebound, all I want to do is curl up on the couch in pain, unable to go to work sometimes.
All of the women I've spoken to test negative for a UTI despite the fact they still suffer pain. Sending a urine sample to the lab is the most reliable test for UTIs, but results can take days. So GPs often use a faster dipstick test, but that can give negative results, as one urologist told me.
If you look at the sensitivity of this dipstick testing for the assessment of the urinary tract infection, the sensitivity is very low. There are a number of studies that are done, and they indicate that the sensitivity may vary from 30% to 50%. So suppose if you are just relying on dipstick testing, and if patient has got symptoms of UTI, whether it's mild UTI, moderate UTI or severe UTI, and the dipstick test is negative, you cannot rule out the possibility of false negative test.
If women aren't treated for UTIs, what could happen to them?
If the women are having symptoms of UTI, and if it's not picked up earlier, and if the diagnosis is missed, they can develop chronic UTI.
For Leanne, she felt private treatment, which involves paying for long-term, high-dose antibiotics, was her only option. This treatment is unavailable on the NHS, and she says these have improved her symptoms. So currently you're paying for private treatment, but you've been in treatment for a while and you're still in pain. Do you think that all of this cost is worth it?
I know from the support group there's been women that have been in treatment sort of 4 years and they're starting to feel better. I think it's just finding the right combination of sort of antibiotics.
It's not just Leanne. Anna and Lauren have also been in pain for years. Lauren couldn't get diagnosed on the NHS. She got diagnosed privately and was given long-term, high-dose antibiotics, which have improved her symptoms.
When I actually total up the costs of everything that I need to pay for to get there, get treatment, come back, it's the private consultation in itself, and then because you can't get your prescriptions on the NHS, you also pay for those. So my average cost of a trip to London is about £600–700.
Anna recently saw an NHS consultant who she felt didn't take her condition seriously.
I was referred to the urologist on the NHS. It took months, obviously, and then I went and I just felt very dismissed. And all in all, the appointment was about 5 minutes long. So I had to explain my years of pain that I've went through in this 5 minutes and kind of plead my case almost.
The NHS doesn't routinely offer long-term high-dose antibiotics as a treatment for UTIs.
We always have to worry about long-term antibiotics because that can cause antibiotic resistance. And just to emphasise, that antibiotic resistance is about what happens in society, but it's also what happens to that individual person. So that individual person is more likely to develop antibiotic resistance, and then antibiotics won't work.
There are no easy answers. And with women being left in pain, all agree more research into this debilitating condition is needed. India Grant, BBC News.